Hello students, I'm Miss Wood again, and I'm here to show you to go step by step through the checklist with administering medication by intravenous piggyback through a saline lock. Okay, so remember that a saline lock has no fluid going to it, so we'll just have a saline lock on our patient. Okay, so the goal of this procedure is to medication is delivered safely to the patient via the intravenous route using a sterile technique. Okay, there we go. So the first thing we're going to do is check our doctor's orders. Okay, so we're going to check our doctor's orders, and our doctor's orders say Rosefin 1 gram IV piggyback every 6 hours per saline lock. Okay, and we're going to check our orders against our MAR and make sure they match, and we're going to check our patient's allergies, and he has no known drug allergies. Check our patient's name, make sure we have the right patient. Okay, so we've carefully checked our orders, and we're going to clarify any inconsistencies. We don't have any inconsistencies with our patient, and they're not allergic to the medication that we're going to be giving. And then we're going to wash our hands. We're going to wash our hands. We're going to gather our supplies. So we're going to need 2 pairs of gloves. Okay. 3 alcohol preps, or I put extra alcohol preps in my pocket just so that I have them. Our IV piggyback medication, which is our Rosefin 1 gram. Okay, our yes, Rosefin 1 gram. So we notice that it's to infuse over 20 minutes. So you'll have to calculate that dose for me, okay, when you do that, when we get that. So we'll talk about that. We'll need our secondary tubing. Secondary tubing. You need secondary tubing for this procedure. You're going to need a small bag of normal saline and a primary tubing, okay, because we're going to hang that up as our flush. So just remember that that's just going to be as a KVO rate, and I'll show you how to do that when we get there. So 2 syringes with normal saline, and then and that's it. That's all we need. So we got our supplies, and we're going to go to our patient's room. Okay, you ready? We can go to the patient's room. Knock, knock, knock. Introduce ourselves. Hello, my name is Debbie. I'm going to be your primary nurse today, and the doctor's ordered for you to have an antibiotic, and we're going to get you started on that. We're going to wash our hands, okay, and identify our patient. And the way we identify our patient is just like before in the other videos, where our 2 identifiers, which are name and date of birth. So we're going to check the name on that armband and the date of birth, and we're going to compare it to the MAR. Okay, we're going to compare it to the MAR, and we're going to scan them, and we're going to ask our patient to state his name and date of birth. So he's done that. It's Mr. Sam Neal, and we're going to start with our procedure. So okay, so we're going to prepare the correct medication, and what we're going to do is we have looked in the Davis Drug Guide to be sure that to see if our medication needs to be diluted, and it's already diluted. It comes from pharmacy like that for us. We're going to check the expiration date to make sure it's not expired. We're going to consider the appropriateness for our patient. Of course, this is an antibiotic, so he must have an infection. So we could look at his WBCs or whatever is necessary to find out if that's the correct medication that we need. And we're going to prepare our medication. Okay. So the way that we prepare our medication is we take our secondary tubing. Okay, and we open it. And just like before, we're going to make sure that, remember our roller clamp, and we're going to lock it down, lock it. Okay, make sure that it's locked so that we can spike our bag. Remember, we're going to keep it sterile, just like before. Take the top off, put it down, make sure that it stays sterile, and we're going to twist and twist and twist until we get it in the bag. Okay, and then we fill it half full. And with this medication, we want to be careful when we let it roll down into the bag, into the tubing because we don't want any bubbles, but we don't want to waste any medicine either. So we're going to let it roll down in the bag slowly until all the way to the end. Okay. And then when it gets there, then we're going to clamp it back off. Okay. So we've clamped it off. That's our secondary medication is ready. Okay. So in order to hang that secondary medication, we're going to have normal saline. We want to make sure that it's compatible with normal saline. So we've checked it and made sure that it's compatible. We've checked and made sure that the rate that the pharmacy has suggested or requested or required is suitable as well in our Davis stroke guide. So we've checked all that to make sure that the rate is right. Okay. Let's see. Prepared our medication. We've determined if the medication should be diluted. It's diluted by the pharmacy. We spiked our bag, and now we're going to spike our small bag of normal saline. So our small bag of normal saline. Remember, we're going to do this normal saline because this is going to act as our flush, and it's also going to help keep our line open and keep our medication running at the appropriate rate. So we do the same thing. We open our primary tubing, and this is the tubing that has what goes in actually inside the machine. It's going to help regulate. So we're going to regulate this, and then we're going to attach our secondary to the top of this so that we can also set it into the pump. So just as before, we're going to make sure that we keep it sterile, make sure that our line is clamped off. It's clamped, and then we're going to take this wrong one, and we're going to twist and turn and insert it. Then we're going to fill our chamber half full. We're going to set it on the pump to run as a KVO, and that's between 30 and 50 mils an hour. Okay, so that's what we'll have to set on our pump to run as KVO. Okay, so we can insert this into the pump. Okay. Yes. Okay, so it goes into the pump. I don't know that does this one actually fit into this pump? I think it does. Does this one actually fit in this pump? It doesn't. Oh, maybe it does fit. Well, we're going to pretend like it fits, okay? We can zoom that out, right? Stop. Or just keep going? Keep going. Okay. Okay. So we've got that primed, and we're primed. No, I've got to prime it because I didn't prime it. So in order to prime it, you just have to kind of pull this apart. And with all of these tubings, you'll have to either pull it taut or pull the little thing out to make sure that you prime it. We're going to prime it. And your instructor will always be with you to help you make sure your tubing is primed. Okay, I'm going to prime it all the way down. Make sure it's good and primed. Okay, and there's no bubbles. Okay. And then we'll set this into the pump, and when you set it into the pump, you will turn it on, and you will set the rate, and the rate will be between 30 and 50. That is the KVO rate, okay? And then you can go ahead and unlock it because it's set into the pump, and you can set your secondary into your primary. Okay, and then I gotta turn this off. And then make sure that nothing is not on yet. So you're not on your secondary yet, but you can actually roll or clamp it open so that you don't forget to do it when you set your pump. So it's your primary is going right now at your keep a vein open rate. We haven't attached it to the patient yet, but we can actually do that. Go ahead and set that to the pump. And then also we need to lower our fluids, and you have this little handy dandy little thing here that helps lower the fluid. So this fluid is higher than this fluid, so by gravity this one will go in first. Okay, so we've spiked our small bag of primary solution, and then we've hung it, and we've actually done that. And so we're going to put on our gloves, and we're going to check our IV site. Okay, so in order to that, we need a alcohol prep and a saline, normal saline. So we can look at it and tell that if it's been infiltrated or not, and it's not red and it's not warm, and it looks fine in the arm. So we're going to scrub our hub for 15 seconds, and then we're going to attach our flush, our normal saline flush, open the clamp, aspirate, and make sure that we still have it's in the vein and we're getting blood back, and we are. And then you can advance 3 to 5 mils to make sure that it's still patent. So you're going to make sure that you look at it and make sure there's no infiltration. The patient doesn't feel any pain there or it does not show any signs of infiltration. Then we can get another alcohol prep and clean our hub again. Scrub for 15 seconds. And then we're going to attach that primary line. Attach that primary line so that we can run our primary fluid and then have our secondary attached to it. So we'll actually turn our pump on, let our primary fluid run through for a few minutes, and then we're going to push our button on hold and set it to secondary, and we're going to put in the rate that we calculated and got for this Rocephin, 1 gram, and so it's going to be for 15 minutes is probably about the rate that it's going to go. So we're going to set that to secondary, and we're going to turn that pump on and let it run, the secondary run. Once the medication has infused, then it will flip back over to the primary and run at 50 mils an hour, or 30 mils an hour, 30 to 50 mils an hour, and those 50 mils we can put in, and then just let 50 mils run in, and then the pump will start to beep, and then we can come in and turn it off. Okay, so all that time that we start the medication, we want to make sure that our patient is not having any adverse effects from our antibiotic. We also want to recheck the site to make sure that no infiltration has happened while we're preparing to get him ready to go. If we have raised the bed or lowered the side rail, then we'll make sure the side rails are up ×2. The bed is low in lock position. The call bell is within reach. We can take off our gloves. Okay, we can talk to the patient and ask him if there's anything else he needs, and then we can document. Okay. And what we're going to document is the time and date of the medication administered. Okay, so we know that we gave Rocephin and whatever time we started it, the name and the dose of medication, the location of the IV site, how it appeared before and after, and then how the patient tolerated it. Then we'll have to come back after the medication has gone in, and then take all our supplies down. And that's it. Thank you very much.